I'm based in Pembrokeshire, which is southwest Wales, and the place where I work is called Brokerwen. It's just opposite Withybush Hospital. My work history is quite extensive. I qualified in 2000 from Coventry University, and I've worked in many settings ever since. I worked for the NHS in Northamptonshire for 5 years, mainly in mental health services. I did some private practice, and I also did some locuming, so I had the opportunity to work for forensic services. So my current role is Band 6 Occupational Therapist in a community mental health team, and within that role we obviously provide an OT services to adults with mental health difficulties. As an OT in the team, we look at doing assessments using the MOHOS, which is the Model of Human Occupation, and we use that to guide our practice. So within our role we do a lot of OT specific tasks, but we also do a lot of generic working, like care coordination. And at the moment we are just going through some changes, so we're just starting to set up some new groups, one being recovery through activity and another which is looking at wellness recovery action planning. My hobbies and interests are mainly horses. It's quite a lifestyle really. I've got a horse and I've got a pony for my daughter, and they need looking after daily. So yeah, it's really active, gets you out and about, see nature and always looking after them. I've got 2 children, so a lot of my leisure time is spent running around to birthday parties and going to the parks and to the beach. I chose to live in Pembrokeshire, mainly moving back to the area, and I wanted to give my children the same opportunities that I had when I was growing up. So mainly my husband was in the RAF, and we got fed up with moving around with his work, so a job came up for me here, so I went for it and was successful. And now, we're in a property that we can afford. We've got the beaches on the doorstep, so it's a nice free activity we can go and do with the children, bit of fresh air, nice exercise. We're hoping as the children get older to use all opportunities that are available to us here in Pembrokeshire, mainly surfing, kayaking, lots of things out in the water and along the coastal paths, so lovely walks we have around here. We have an excellent clinical lead, Nikki Thomas, and she's very driven, very motivated and very encouraging to all of the staff. We have regular meetings that she sets up and looks at service delivery and encourages us to look at our practice and develop. The team's very supportive here, and that's including the nurses, social workers or support staff.